Okay, so hi there, I'm Carolyn, trichologist here at Absolique Hair Health Clinic. Today we're going to be talking about some latest technologies that can help you with hair loss and hair thinning. That's my specialty. I also help with scalp conditions, but today we're going to be talking more about hair regrowth. So I'm always looking for some new science that's going to assist the clients. So today we're going to be talking more about PRP. It's cosmetic injectables, obviously, to help with hair regrowth. So we're going to introduce you to Diane Mayes. She's a cosmetic practitioner and registered nurse and founder of EsthetiqueNY. I think I got that right, a new you. So she specialises in cosmetic injectables. There's also a skin clinic that has very many other exciting treatments, which we will cover off today. So welcome, Diane, and thank you so much for taking the time to join us. Okay, so we'll get started. Oh, thank you, a bit of a delay there. So I'd like to get started by, can you share, how did you get into this really sort of exciting field, and what made you look for the latest science and technologies that I know you're using today?
Well, I got into cosmetic injectables, or that's cosmetic nursing, many years ago. It was something that I always I had an interest with. And I worked with a plastic surgeon many years ago up at the Sunshine Coast, and then I moved to Brisbane, and I sort of wanted to pursue that. So I got some work with an injectable company, and I loved that, but I was limited with what they had to do. So I thought, good opportunity to branch out on my own, which I did. And with that, it's always been my biggest focus to have a point of difference. My passion is skin, to always do some research, find the latest sort of things, and just wait until I find the right things. And over the years, I fine-tuned my treatments, which really skin is, as you know, the biggest organ that we have, and it's completely fixable. And the same with hair loss. You can do certain mechanical interventions which completely can change losing your hair or change the way your hair grows back. And with those specialty treatments, it's my niche thing now, and really busy, and I love what I do. I feel very privileged.
You've been so kind to invite me in to see some of your treatments. It's just amazing, I guess, what's involved from a medical perspective. So appreciate your background in nursing. But what you do, what you showed me, what you're doing with someone's own blood when you're doing this PRP, or what you call advanced PRP, it's unique to anything I've seen. Do you want to talk a little bit about your difference?
Yes, my difference. The way I do it is actually, I'm probably one of the few people in Australia that does it. It's big through Europe, so it's not my thing, but I did get the information from there. But I work with a plastic surgeon, and we use the same technology for bone grafting. But on the machine, there are two settings, which one's for biological filler, and the other one is inductive collagen. And I know that PRP on its own is fantastic for hair loss. But when you do the inductive collagen, and that's when the plasma is made up of three main components. There's a concentrated part, which is down the bottom. That's CD34, protein-rich plasma, and protein-poor plasma. With the hair, you mix the CD34 and the protein-rich plasma together, and then you put it in a special incubator for 20 minutes. And when that happens, it makes it so much more rich with growth factors. So it's equivalent to doing about 10. So you really can fast track your results. And with that, you get noticeable results quite quickly. So yeah, it took me months to get to translate it from Italy, because it's big there. And the reps here in Australia aren't here for that. It's more for the dentistry side of things. So yeah, even though it's not mine, I feel like it's mine.
Well, I feel like you really have taken it to another level, from what I've read and what I've seen. And you've also shared some results with me, which have been astounding. In particular, the one you shared me of a young female. She had a hair part that was quite wide, which she was concerned about. So you showed me a before and after. And you said that was one treatment, 1 month's difference.
Yes, and it is as remarkable as that. And even with an older male who's losing his hair, he has it. It's been over a year now. He just comes in every month, and I think we've literally slowed down what was inevitable, and that was for him to become completely bald, the back of his head,
male pattern thinning.
So we've completely, well, he's still got a little bit of thinness there, but it certainly doesn't have a bald spot anymore. And it would seem to have stopped it from getting any worse. And he's really happy with that. And it's with him, I feel, how long is a piece of string? Just keep going with it, and you know, we can prevent him from becoming bald. Which, you know, as you know, a lot of men, that's their biggest fear. You know,
it is, and the treatments that are generally available. Like I help people in I guess holistic combination therapy type treatments. But when you've got this typical patch of baldness and it's beyond a point, there's limited you can do. You can help. Prevention's my thing. But what the advanced PRP that you're doing, that's enhanced, it's actually getting hair regrowth on people who I would consider are normally ready to have a hair transplant. So,
yes,
you know, to me, it's a lot less invasive, it's quick, easy, and it's local as well. So you know, I feel like there's a big market there for the male pattern thinning. And I do see, unfortunately, a lot of younger women with the female pattern thinning
yes,
as well. So I really feel like, you know, it's something that we can really combine together. And I think one of the standalone things is, particularly with the male pattern thinning, you know, you normally have to address it in so many ways, but it is actually delivering a result even as a standalone treatment. You know, and
yes,
it's something that is from, I call it, of their own body. Like it's not
yes.
a drug, you know, it's not something that's chemical.
That's exactly right. And with that too, there's nothing that's added to it. I know that there's some PRP treatments that, you know, there's something added to it. This is all completely untouched, just, you know, inducted at the right setting, and this machine does it all for them. Just heat it up for 20 minutes and voila. It's just, you know, so much more rich with growth factors. And I guess with that, that's probably what the scalp needs, you know, growth factors from your own plasma. And plasma is clever. I've found over the years, it just seems to know where it's got to go. Like even when you put it in your face, for example, for, you know, beautifying, you just pop it in and it just, even when you put it under the eyes, it just kind of goes, it knows where it's got to go. And I find the same with the scalp. It just kind of bonk it in and it just seems to disperse the right way. It's quite interesting.
I remember, you know, viewing it with you, and you got me to come over really closely to have a look. It was fascinating, and it really did. I guess I have a question there, because a lot of my clients have, you know, hair loss over the entire scalp. It's what we call more diffuse hair loss. The treatment I saw you during was obviously targeted, and you went that whole pattern thinning because you maximise your product. I saw how many vials you extracted from that client for a cost-effective and, you know, and a thorough treatment as well. Do you ever treat the whole scalp?
I've never treated the whole scalp. No, it's usually, but mostly most clients that I have that have, you know, hair problems, it's usually a particular area that they're concerned about, and that seems to always be the case. And I feel that if someone was completely bald, then I don't know, I'm not confident that I'm not sure what would happen, to be honest with you. I've never treated someone with hair loss that bad.
They're never completely bald, it's just a diffuse hair thinning. But my thought pattern was, most people who come to me, they're concerned about what's visual to them. So I feel like that for cost effectiveness, that's where you would target the treatment, like I have seen you do as well.
Precisely. And I guess with that as well, just so people know that, you know, I haven't had to do it yet. I'm getting great results just with 2 tubes of blood. But if someone had a larger area, you can certainly take 4 and just double the treatment. So you can still, you know, get twice the amount of plasma. So there's ways around that. The bigger the area.
That's what I thought. I mean, I'm just so excited by what I've seen so far as to what else, you know, hasn't it particularly been used for, such as, you know, patches of alopecia areata, which are autoimmune. I've got a client who's got traction alopecia that's been there for, you know, 15 years. I just think it's super exciting. There's a particular thing called frontal fibrosing alopecia, which I'd love to have a go with because of the growth factor and what it actually can do. So let's dig a little bit deeper in there. For treatment-wise, you know, to be fair, how many treatments are reasonable for them to continue to see? You know, obviously you get a result in a month, but how many would they need?
That's a good question. Look, I'm finding that usually 1 or 2 to start with, you know, for especially young people, or actually no, all sorts of people, depending on the amount of hair loss. After the first treatment, it always, I get a little bit excited and always repeat it within the month. and then maybe the third one, and then there's enough, they're satisfied enough to just leave it for a bit, and then they'll come back to me in 6 months when it's time to do another spurt of, you know, 1, 2 or 3. That sort of seems how you know, keeping the bald patches away. Even, you know, especially a lot of young men with that typical bald patch at the back of their head. That's, you know, I've got one, he comes in every 6 months for a top up,
Wow.
and that's enough for him. He has minoxidil with it as well, and he's, you know, he's really happy with that. Whereas my regular client, I think he's so scared of it going backwards. He's just, when he leaves, he books. So it would be interesting to see if he did have a lot of hair loss if he stopped the treatments, but he's so happy, he just keep going.
I guess the interesting thing that with my clients, we've done a lot of groundwork. We've addressed the underlying causes. We teach people with the typical male pattern thinning that it's all about the DHT binding. So we've addressed all of that. So then I think if you add in the PRP on top of that, they would get even more exceptional results. I've also made sure that they're otherwise healthy individuals, that all their nutritional levels are in place. So I think if you add that on top, wow.
Yeah, that's the whole package. That's because I agree with what you're saying. There's always a reason for this, and your job is to find the reason and that's a really important part of it. All I do is mechanically, you know, it's a mechanical intervention, but what you do is crucial to get to the final end result. It's a match that is made for, it's a formula for.
Absolutely, yeah, and that's what excites me so much, is that I can take it so far. But this is really, truly hair regrowth for people. And at the end of the day, you know, that's what they want. And they can choose to treat the other things and do it combined, or they can choose to take it on its own. And I take it very individually and ask very particular questions, you know, of my clients to decide, you know, what could be better for you. And there's many options out there. So personally, I offer a free 15-minute consultation, which I would normally do over the phone, to establish what kind of treatment, you know, would they like, and what are their concerns. And I know that you are going to do a similar thing for my clients as well, is that they can have.
Yes, because I'm so excited to help and to work with you and to, you know, to share this, because and thank you for discovering me. Not many people know what I do. I'm happy to offer a free consultation and take $50 off the first treatment, you know, just to get the ball rolling, just to get, you know, incentive for people to say, oh, this is not a gimmick, it works. So yeah,
that's super exciting, super exciting. Thank you so much. And I guess that takes us into sort of discussing pricing. And, you know, it's interesting, I've been talking to my clients about interviewing you today, that I was so excited to get out there. But people ask me a lot about energy medicine. And one of the things they use in energy medicine is laser. Okay, the latest laser treatments are the laser caps, and they are amazing. They use combination of LED, UV, you know, they've got like 1,000 diodes. They are the top of the range in Australian dollars, $4,000. Yeah, and then you have to use the thing. So when I mentioned to someone the cost of your treatment, they said that's nothing. I mean, obviously there is a cost, but, you know, we're looking at, you know, maybe one a month for the first 3 months and then some top-up maintenance. So what is the cost sort of per treatment?
Well, generally I keep the prices low just for awareness, and with that it's grown phenomenally. I'm just so busy, and I bet I'm not greedy with that. I haven't put my prices up, which I should have done, I guess, accordingly. So it's just $6.50 a treatment, but for all new clients that come, you know, if you're watching this, I'm happy to take $50 off the first treatment. So it's affordable. The treatment takes about 2 hours. As you know, it's pretty invasive. So, you know, they have to be really well hydrated, you know, and know that it's not pain-free, but I do my very best to make it as painless as possible. I go to the extra effort to, you know, have, you know, quite strong numbing gel on the scalp, and also the option of injecting xylocaine into the scalp. So when you actually do the treatment, you don't feel a thing. But getting it to that.
To be fair, the procedure that I saw, I was having a conversation with your patient and you were doing your thing and he was not perturbed by it at all. I was quite amazed. And also, to be fair, I have obviously had some skin treatments with you to feel it for myself. And I had the numbing treatment, and to be honest, I couldn't feel a thing. So as much as it might look invasive or sound invasive with needles, you don't feel it. And I guess as the patient in the chair, you don't see what's going on. So, you know, therefore, you know, it's not a concern. Yeah. So I guess with that, you do some other amazing treatments. Do you want to talk a little bit about your other treatments?
Well, with the machine, if we're still on talking about the plasma, there's another setting as well to actually use people's own plasma as filler. And I'm starting to lean, I've been doing cosmetic injectables for years, you know, filler, lips, the whole thing. I feel that using plasma for filler as well is another beautiful treatment. I use plasma as filler when you induct the protein pore plasma at a very hot setting. And then when that's cooled down, you mix the CD3/4 and you actually literally use that as filler. So that's another beautiful, I don't know anyone else that does that. And the results for that on my Instagram, you'll see them. They're amazing. Can do the whole face. And I've got a new machine, which I love. I saw it in New York a couple of years ago and I fell in love with it, but they didn't have distributors here. So if I was to buy it and get it serviced, it would have cost me a lot of money to get it serviced. The Exilis Ultra. It's a targeted radio frequency machine. So it's got two heads. One is for, you know, skin tightening, radio frequency. And the other one is for fat reduction and skin tightening. And oh my gosh, it's amazing. When you just do the eyes and the lower face, just after 2 or 3 treatments, it's like having a mini facelift.
Wow.
So it is just phenomenal. It's so good that I have hurt my back a little bit. I need some helpers. It's a big job. But no, it's great. What else do I do? Of course, the cosmetic injectables, you know, epidermal blading. It's not all, mostly what I do is quite invasive, to be honest with you. I don't just do needling on its own, you know, that's great for collagen, you know, collagen. I always, you know, why not just pop a vitamin retinol peel over the top? Really, I like to fast track results and nourish the skin with the right, you know, peels, treatments, masks, but everything I do, I guess, is compounded, and it's very results driven.
And I guess when I first found you, I was so excited, you know, by what you shared with your PRP, and I decided to embark on a little bit of a journey with you, just so I know if I'm recommending to my clients what they can expect. And I found with every treatment you have given me, you've got all your add-ons, which are included to maximize. So, you know, I wouldn't say, again, they've been invasive for me. You might have, you know, a day of, you know, dry skin or a little bit of redness, but the results, you know, you can see within a week. And I've had people comment about my skin, you know, and it's amazing. And one of the things I find super interesting is how you do the microneedling. So all my clients, we use a microneedle on a roller, but yours is very, very different. It's so fast moving, and the depth that it gets to. You want to talk a bit about that?
It's a skin needling device, and it's got 12 very fine needles, but the difference is they will oscillate up and down very quickly. And with that, you get a lot more penetration sites to the skin per second. That's straight up and down, so no trauma from the rolling, I suppose. It's great for the scalp, what you do, of course. But this one, for the face, you get 1,296 penetration sites to the skin per second.
Wow.
And then you do 2 or 3 passovers on the face. So the whole skin, it's a blanket cover of the skin being penetrated. When the skin's penetrated, it goes into the skin cycle. So, you know, inflammation, that's what you get, a little bit of redness, then proliferation, and then maturation. This phase of wound healing takes 28 days, and that's why you do one treatment, you know, another one in, say, a month. And the skin that comes back is new. You get a new skin cell. So you can pretty much, you know, you can be as young as you want to look. Aging really is, with these treatments, an option. Just, you know, I chip away at doing all sorts of things. Another beautiful one is when you put Botox, I know this sounds ridiculous, or muscle relaxant, I should say, into a glass vial with, it's got little gold heads, and you mix vitamin B3 and C into it, and you stamp it into the skin of a depth of just 0.6 all over the face. It's just, and when you put muscle relaxant just into the skin, it has a skin tightening effect. It's fantastic before, you know, special events. It's, you know, have a glow, can be, light, strong.
Wow, it's just so exciting. And I guess in general, you know, particularly, you know, my female clients and male clients, you know, we're all like to save our hair. They're also looking at anti-aging and everything else. So I feel like, you know, your services really fit in with my holistic approach. You know, that we've got all the collagen and everything coming from the inside, and then you're sort of just connecting it from the outside. So
yes,
I think it's such a super exciting collaboration.
thank
So
you.
I guess,
A lot of my clients do say that they don't ever want to go down that neurotoxin pathway or filler pathway, and they're loving, you know, what I do, because I offer something on par, and I feel if not better in some ways. You know, it's about stimulating the collagen, rebuilding collagen, which is more permanent. So yeah.
And it is more natural, because these days there's so many different endocrine disruptors, and a lot of them are in the cosmetic products. So I just love what you're doing is from their own in a natural way, and just rebuilding it
Yes,
the inside out and the outside in at the same time. Super
exactly.
exciting. So just to wrap up, is there anything else you want to mention that we haven't covered?
No, I think you've, of course there's more, but you know, I think we've covered the main ones. So I think every person that comes in, it's the consultation or the treatment is done according to what their needs are. So it's all individual. So that's something that it's better to, when I meet new clients, to just discuss, you know, what are their concerns, what journey, what path are we going? And there's no, with any treatment, okay, let's fix it now. It's part of the journey. You know, you put a plan together and you tailor it, and you might change it up each time. So it's all individual.
Very good, because I'm so much into it's for the individual person at that time.
Yeah,
yep,
exactly.
So if people wanted to get in touch with you, you mentioned before your Instagram. Where would they find you on Instagram?
My Instagram, I should have had that here with me. I'm so sorry. Just give me 2 seconds.
We can post it at the end of the video, because I do have it on your card, which is in front of me.
Okay. I've got it right here. I'm so sorry. I've got a Facebook and an Instagram. Each one is slightly different with the hyphen or the dash, but the Instagram. As you can tell, my daughter does all of my.
I will actually put it at the end of this recording today, so it's there, just so they've got it right. Yeah, hold it up. That's fantastic, fantastic. Okay. I'll put it on my website and things like that as well. That's fantastic. Love it. We can see both of them there. Take a screenshot of that for my clients if you're interested. So perfect. So best way, is it through Instagram or Facebook or website, or is there a number people can call?
Yes, my number. I do prefer people to, and if people aren't sure what to book, just book anything. I mean, if it's you know, if it's or a consultation time, or I can be contacted by my mobile number. The number on my website does go through to my mobile, and you know, so I do my best not to miss people. But if they can book it themselves, it does make it easier for me. But in saying that, if anyone has any questions, they can email me or just give me a call. And if I miss them, I'll call them back.
Perfect. So I guess, you know, just to recap, that we're going to offer them a consultation, so they can come to you first, have a chat about what they're trying to achieve, and then their goals, and find the journey for that. That's complimentary, and $50 off their first treatment as well. So from my perspective, I'm also offering, you know, a 15-minute free consultation to help people decide. Obviously, for my clients, they've taken a certain path of hair loss treatments, and how to integrate or change path to introduce the PRP. So I'm happy to chat to, you know, existing and new clients as into what's the best pathway for you. And I guess for me, it's super important, particularly with women, because if they have hair loss because of an iron deficiency, the PRP is going to help, but it doesn't address the underlying cause. So I think both you and I, we want to maximize people's spend and result by addressing, I guess, everything together.
Oh, 100%.
Fantastic. Just location-wise, we're based in Brisbane, Spring Hill, and you're just around the corner from me, which is fantastic. So you're Bowen Hills, is that right?
Bowen Hills. I'm in a big building with other lovely practitioners. It's called Refine Health. So it's 22 Campbell Street, Bowen Hills. You can't miss where I am. It's a big white building. So it's on the corner, Refine Health, and it's easy to find. Yeah,
Yeah,
and there's lots of
I love
parking.
that you're local, that there's parking there, and that you really
Yeah.
are in a beautiful building with lots of other professionals, which is super interesting
Yeah.
every time I go there as
Yeah,
well.
great.
Okay, so well, thanks again. This has been super interesting. I could talk about this forever, but we'll put this out, and you know, we'll be working together for the future.
For sure. I look forward to that.
All right.
Thank you for your
Thank you
time.
so much. All right. Bye for now.
Bye.